down in price. Here's another thing that we think is extremely important. One of the problems we have is we don't really have a consumer dynamic in healthcare. People don't always care what things cost or how good care is going to be because they don't get that information. We actually immunize or block the ability for people to actually see what things cost in healthcare or to act like a consumer. Let me give you an example. Jana and I have 3 kids. They're 33 months apart. We call them Irish triplets. Our 3 kids had 3 tonsillectomies over the course of 3 years in Janesville, Wisconsin, from the same ENT at the same hospital. At each one of these times, I tried to find out, what's this tonsillectomy going to cost? Never could I get that answer to that question. I only found out what it costs months after those procedures when I got various bills from the ENT, the ear, nose, and throat doctor, from the anesthesiologist, from the hospital. And the variation of price between those 3 procedures from the same doctor in the same hospital within 3 years was huge. One of them, the recovery bill, the recovery for my son, he sat in a lazy boy, ate Jell-O, watched SpongeBob for 2 hours. That was $1,400. I mean, this stuff is crazy. We don't shop like this for anything else we buy in our life. Why should we shop like this for health care? And so what health savings accounts achieves, this is the law that I helped write in 2003, something that we as conservatives have been fighting for the whole time, is we want to increase health savings accounts, which is what we do in this bill, so we have more competition and lower costs. Here's the point I'm trying to make. In 2000, I got LASIK surgery. The reason I can see you all so well is because in 2000, I got this LASIK surgery, which was elective. Insurance didn't cover it. And so I knew exactly what the procedure was going to cost up front. And since then, this excimer laser that does this procedure has been revolutionized 3 times, and the price is lower. So in this area of healthcare, quality went up and costs went down because I cared as a consumer what it was. So it's not that that dynamic cannot happen in healthcare, it's that it isn't happening throughout most of healthcare. And what health savings accounts does is it helps hardworking taxpayers get access to affordable solutions to help them pay for their out-of-pocket costs, but it's also their skin in the game, their money. If they save money by saying to a hospital or a doctor or a healthcare provider, what is this going to cost me? Where's the best value for my money? If we can bring that consumer pressure to bear in healthcare, we can dramatically enlist the support of millions of Americans to help us fix this healthcare problem. And that's one of the critical things we're trying to achieve here. Instead of using OPM, other people's money, to pay for healthcare that you don't care what things cost, we want to harness the power of the marketplace, the power of the consumer, of the patient and the doctor to demand better services, to demand better quality. We want transparency on price, on quality, and an economic incentive to act on that thing so that we can bring consumers to the bear. This is what we say, this is what we mean when we say we want a patient health